The MCL is a collateral ligament. It's on the inside of your knee. This is a right knee, so it's right here. And that ligament injury, it can be graded, 1, 2, or 3. 1's a tweak, 3 is a complete tear, and 2's everything in between. So a grade 1 might take 1 to 4 weeks to get better. A grade 2 could take 4 to 6 weeks. A grade 3, which means now the knee is a little unstable on that side, depending upon the position. If you're like a down lineman, an offensive lineman, you can put a brace in that guy, can probably get better, or he can probably play within 2 to 4 weeks, but he's going to be braced. So if you're someone like a running back or a wide receiver, it could be out a little bit longer, and they have to brace the knee during the injury, and they brace it bent a little bit. And the hope is keeping it bent, it allows it to scar down. But it's really a wait and see type injury to see how well it heals. They don't normally reconstruct the MCL like they would reconstruct the ACL. But if you have an ACL-MCL injury, and this is completely torn, when they go reconstruct the ACL, they will reconstruct the MCL then.